Okay, today we're going to talk about your role as a PCI when assisting patients with their medications. So, what are your thoughts when it comes to helping someone with taking their medications? Would you think about if you had the right medication? Would you think about how much of it should they take? How would they take it? By the end of this class, you'll be able to differentiate between the 9 rights of medication administration. You'll demonstrate critical thinking skills as we go through the 9 rights and have a discussion, and you'll be able to demonstrate the 3 checks of medication administration. Not only do we check the 9 rights, but we also check the 9 rights 3 times, and this is where your 3 checks come into play. We'll discuss this more towards the end. So, the 9 rights of medication are: you have to make sure you have the right patient. You'll do that by positive patient identification, using 2 identifiers. Then you must make sure you get the right drug. Many drugs have similar names and spelling. You must make sure you have the right dose and you're providing it by the right route. Then you think about, is this the right time, the right day the patient's supposed to be receiving the medication? Is the patient taking this medication for the right reason? If they complained of something, would you know what medication to give them? Next, we'd have to look at the expiry of the medication. As drugs or medications age, their potency fades. Once the patient receives the medication, they must complete the right documentation. The golden rule: if it's not charted, it's not done. So, first of all, we got the right patient. We'll read the patient's name on the prescription label, and we'll compare it to the corresponding MAR sheet, or medication administration record. Once we see the name matches, then we can proceed to our positive patient identification. We can do this by either checking the armband, asking the patient their name, confirming the patient's name with a familiar staff member, or there may be a picture accompanying their MAR sheets that you can compare to a picture that would be on their wall over their bed. So here we are in our first example. What if Mr. A. Smith received Mr. B. Smith's medication? If Mr. A. was allergic to Mr. B's medication, they could have an anaphylactic reaction, life-threatening. Mr. A. could have adverse reactions or effects from Mr. B's medications. He might suffer extremely low blood pressure, for example. There might be side effects from the meds, such as dizziness or fainting, and that could put him at risk for falling. Depending on the medications that he received, death could result. If Mr. B was on insulin, a diabetic, and Mr. A wasn't a diabetic, receiving someone else's insulin when you're not even a diabetic will result in a quick drop in blood sugar levels. It could lead to shock or even death. The right drug. Again, we're comparing the prescription label to the MAR sheets, paying particular attention to spelling of the medication, as many drugs have very similar spelling and names as previously mentioned. However, they're very different drugs with very different purposes. So, instead of getting overwhelmed with the possible drugs, the possible classes of drugs, the dosing, side effects to look for, the possibilities are endless, I would strongly encourage class to explore the drugs.com app. It's a great, easy to use reference when you're in clinical practice. If you're not familiar with a drug, you can quickly look it up, see its uses, see its doses, see what it looks like, its descriptions, everything. Example number 2. What would happen if your patient received the wrong drug? If the patient received the wrong drug, again, They could get an allergic reaction, possibly a severe anaphylactic reaction. The patient could experience adverse effects or side effects from the drug, especially considering that they're not used to taking the medication. Again, the side effects could include faintness, dizziness, putting them at risk for falls. Death could even occur once again from getting the wrong medication. The right dose. Again, we're comparing the prescription label with the mark sheet to see if the dose matches. We will require a proper measuring device, such as a medication cup, with appropriate markings of measurement on it. Measuring device may come in the form of a syringe. It may come as the medicine cup itself. But please keep in mind that a simple decimal point could make a world of difference. If someone, for example, received 25 milligrams of warfarin, which is a potent blood thinner, and they were supposed to receive 2.5 milligrams, it could be a disaster. There are many different units of measurement. There's ounces, milligrams, milliliters, micrograms, etc. For example 3, what would happen if your patient received too much or too little of a medication? There could be increased or decreased effects. For example, if a person received too much of a blood pressure medication, they could experience very low blood pressure, become very dizzy, possibly pass out, or worse, depending on the action of the drug and how it decreased the blood pressure in the first place. Too much of certain drugs could cause overdose and even death. Now we have a critical thinking activity. So your prescription reads, give Mr. Abel Smith 2.5 milligrams of warfarin POOD at 1700 hours. You have 5 milligram tablets on hand. What do you do to get the correct dose? You use a pill splitter, cut the 5 milligrams in half, and a serrated divot, and that will give you 2.5 milligram doses. And before we get overwhelmed with doing some mid-math, I have arranged for the math instructor to do a little session for anybody who wants to avail of it on simple mid-math, and I'll post the date later. The right route. You can clearly see the theme of having to compare a prescription label with the mark sheet. Later, we'll explore why these comparisons are done. As I mentioned, and in your objectives, we're checking the 9 rights 3 times, and this is where 3 checks come into play. There are many different routes in which a medication can be given. Some medications can be given in a variety of routes. Routes might include PO or by mouth, SL sublingual, SQ or subcutaneous, PR by rectum, IM or intramuscular, IV or intravenous, topical through the skin, inhalation by an inhaler or a nebulizing mask. Example number 4. What would happen if your patient received a drug using the wrong route? If a drug was given by using the wrong route, there could be an increase of drug effects. The drug works slower when it has to be absorbed in the digestive tract prior to reaching the bloodstream. If the wrong route involved the same amount of drug being put directly into the bloodstream, then the increased drug effects would happen immediately. The wrong route may cause adverse reactions and side effects. Again, it could cause death. Since cannabis has become legal, people are making edible products and experiencing delayed effects. When cannabis is inhaled, the effects are felt almost immediately. However, when cannabis is in the form of an edible, such as a brownie, people wait, they don't feel nothing, they eat another brownie, maybe another brownie, and then after some time, the effects start to come in and they're compounded. There's been several unofficial reports of overconsumption of edible cannabis products that were made at home, causing emergency room visits due to inability to function, or what people call body stoned. So they can't move. Now we have another critical thinking activity. What would you do if you only had a PO Ativan tablet on hand and you needed a sublingual wafer? The prescription: give Mr. Abel-Smith 1 milligram of Ativan sublingual BID PRN for agitation. You would have to call the pharmacy and ask for sublingual tablets. You cannot give by mouth PO tablets sublingually because they will not absorb like the wafers do, and this could potentially cause further agitation. The right time. The mark sheet will indicate the time at which the patient should receive their drug. Drugs are usually given at the same time each day. Multiple doses are given at the same time each day. When drugs may be given the same time every other day or every second day. It might be given once a month, once every 3 months. But they are always evenly spaced apart. When drugs are meant to be taken around mealtime, some are to be taken before or after eating. Some had to be given strictly in between meals. Example number 5. What would happen if your patient received a drug at 8 o'clock, 10 o'clock, 12 o'clock, as opposed to the right times of 8 o'clock, 1600, and 2400? A multi-dose drug given only 2 hours in between, the patient could overdose and die. Drugs have half-lives and different absorption rates. If a patient receives their medication too close together, it could have compounded effects. Pharmacies and nurses usually indicate the right times to which to administer the different medications and the mark sheets. That brings us to the right day. Some medications are given alternate days or even the same day of each month, as I previously mentioned. Warfarin, for example, is sometimes given every second day. The doctor may want the patient to receive 5 milligrams in one day, 2.5 milligrams on the next day, alternating the doses. Because warfarin is a blood thinner, the dose depends on blood work, which is checked quite often. Patients who require vitamin B12 injections, they will be given their injections the same day every month, or even the same day of every third month. Example number 6. What would happen if your patient received an anticoagulant such as warfarin every day when the doctor indicated they should receive it every second day? The patient's blood will become too thin and the patient will be at increased risk for bleeding. If the patient ended up having a stroke, they could bleed out in minutes. The right reason was considering a PRN or an as-needed medication, you have to understand the reason for administering the drug. For the most part, PRN medication prescriptions would indicate what to give the medication for. Tylenol or acetaminophen is to be given every 4 to 6 hours PRN for pain. Another example may be nitroglycerin spray given under the tongue for chest pain. Wait 5 minutes, repeat to spray. Ativan will be given for agitation. Gravol will be given for nausea. So example number 7. What would happen if you didn't understand what drug to give if your patient was having chest pain? The patient could suffer a heart attack. The right expiry. This involves checking expiry dates on all of our medications before we administer them. Different drugs have different expiry dates. The pharmacies would know the specifics on what expires when. Drugs that are expired have a decreased effectiveness, therefore they don't work as they should. Some drugs become toxic if they expire. So what would happen if your patient was administered expired insulin? Expired insulin may not decrease a patient's blood sugar like it should, therefore it leads to a sustained high blood sugar, and in turn has many different effects on the body. Lastly, we have the right documentation. The golden rule is, if it's not documented, it's not done. For example, if you gave a patient Gravol for nausea, then you went to your lunch break, the second staff member should be able to tell if you've given the Gravol and when you gave it, just in case the patient complains to the other staff member as well. If you didn't document that you had already gotten the Gravol, this patient could end up with a double dose. All regular medications are documented. The MAR sheet is a part of the patient's permanent record. The MAR sheet is used as a reference if the patient happens to get transferred to another facility or department, such as Emerge. On the MAR sheets, you would sign your initials to the corresponding medication that you gave. And on the bottom of the MAR sheets, you put your initials and spell your name next to it, so you could be easily identified as the person who administered the medication. Example number 9. What would happen to your dementia patient if you did not document her medications and she consumed all of them, transferred to Emerge, and then she was given all her medications again? Adverse effects or reactions and possibly death. Doubling up of medications due to lack of documentation will lead to this. And as you can see, we are now to the 3 checks of medication administration. We compare the prescription label to the MAR sheets. We go through the non-rights, but we will do this 3 times before the patient actually takes the medication. The first check is when we're going down and comparing the prescription label to the MAR sheet while we're collecting the medication. The second check of the non-rights is done when preparing the medication for administration, so putting it in our med cups, putting it in our syringes. The third check of the non-rights is done right before the patient consumes the medication. So here's another critical thinking activity. What is missing in the following prescriptions? Ampicillin by 250 milligrams BID. There's no patient, there's no route. Anaprox, PO, BID, PRN. No patient, no dose, no reason. Nitroglycerin 2 sprays PRN. No patient, no dose, no route, no reason. So if we were faced with incomplete prescriptions, we'd have to seek clarification. In your case, you'd get a nurse to call and take a verbal order, a verbal clarifying order from the physician, and then you'd go from there with a corrected medication sheet. Are there any questions, comments, or concerns? All this information came from your textbook, and I'll now call upon a volunteer student to run through a mid-pass or medication administration using the prescription labels and bottles we have here with mark sheets. And I'd like for the rest of the students to help this student out checking their 9 rates and doing their 3 checks.